Friends, take a moment and think. By the time you reach 65, your body has already changed in many ways. Your metabolism has slowed down, your bones have started to weaken, and your muscles are no longer as strong as they once were. And if on top of all that, your weight starts to increase, it's no longer just a minor inconvenience, it becomes a serious medical concern. But here's the good news. If you or someone in your household is elderly and you start taking the right steps today, life can become better, healthier, and more fulfilling. In today's video, we'll talk about why obesity after 65 is so dangerous, what effects it has on the body, and what steps can be taken that are completely safe and practical, without any strict dieting or exhausting exercise routines. So, let's get started. Part 1. Obesity after 65. A different kind of danger. Many people believe obesity is only a problem for young people, or at most, middle-aged individuals. But the truth is, obesity becomes even more harmful after the age of 65. Why? Because as we age, the body's natural defenses are already weakening. Joints have worn down. The heart and lungs are no longer as strong. The kidneys and liver don't function as efficiently as before. In this condition, the extra burden of excess body weight forces every organ to work even harder. According to the World Health Organization, WHO, approximately 40% of people aged 60 and above worldwide are overweight or obese. In Pakistan, these numbers are also rising to alarming levels, particularly in urban areas where elderly people have adopted increasingly sedentary lifestyles. Part 2. Major health risks linked to obesity. Let's go through them one by one. The serious health problems that excess weight can cause after age 65. 1. Heart disease, cardiovascular disease. Heart disease is the leading cause of death among elderly people, and obesity multiplies that risk significantly. When there is excess fat in the body, blood vessels narrow, blood pressure rises, cholesterol levels worsen, and the heart has to work much harder to pump blood than before. After 65, the heart is already naturally weakening, and obesity accelerates that decline even further. Heart attack, stroke, heart failure. These are among the most serious consequences of obesity at this age. 2. Type 2 diabetes. The relationship between diabetes and obesity runs very deep. When fat increases in the body, especially around the abdomen, the body is no longer able to use insulin properly. This is called insulin resistance. This problem is even more common in elderly people because the pancreas is already producing less insulin. Obesity pushes that deficiency into a full-blown crisis. Diabetes itself then gives rise to several other dangerous conditions: kidney failure, loss of vision, wounds on the feet that won't heal, and heart disease. 3. Joint pain and knee problems. Osteoarthritis. After 65, bones and joints naturally start to weaken. According to one study, every extra 5 kilograms of body weight places 15 to 20 kilograms of additional pressure on the knees. Think about it. If an elderly person is carrying 20 extra kilograms, their knees are absorbing an additional 60 to 80 kilograms of pressure with every single step. This is why knee replacement surgery has become increasingly common among obese elderly patients. Walking becomes difficult, climbing stairs becomes painful, and gradually, the person becomes a prisoner within their own home. 4. Breathing problems, sleep apnea, and respiratory issues. Obesity also makes breathing harder, especially during sleep. Sleep apnea is a condition in which breathing repeatedly stops and starts during sleep. It completely ruins sleep quality, causes daytime fatigue, and has damaging effects on both the heart and the brain. In elderly individuals who carry excess weight, the risk of sleep apnea is significantly elevated. Left untreated, it dramatically increases the risk of heart attack and stroke. 5. Mental health issues, mental health and dementia. Very few people are aware of this, but obesity has a direct connection to brain health as well. Research shows that obesity in elderly individuals increases the risk of dementia, a condition characterized by progressive memory loss. Obesity during middle age or later life is recognized as a major risk factor for Alzheimer's disease. Beyond that, the physical discomfort caused by obesity, social isolation, and loss of self-confidence can all contribute to depression. And unfortunately, depression in the elderly is often overlooked and dismissed. 6. Increased risk of cancer. This may surprise you, but obesity also increases the risk of cancer. According to the American Cancer Society, obesity is linked to at least 13 types of cancer, including breast cancer, colon cancer, liver cancer, and uterine cancer. Elderly women in particular face a significantly elevated risk. 7. Risk of falling, falls and fractures. Falling is a very serious concern in old age, and obesity makes that risk even greater. On one hand, excess weight disrupts balance and stability. On the other hand, when combined with already weakened bones, a fall can easily result in a fracture. A hip fracture is particularly dangerous for elderly individuals, and in many cases, full recovery never occurs. 8. Surgical risks. If an elderly person requires surgery for any reason, obesity makes that procedure far more complicated. Administering anesthesia becomes more difficult, wounds heal more slowly, the risk of infection increases, and blood clotting complications may also arise. Part 3. Are these risks inevitable? Absolutely not. Friends, after hearing all of this, you may be feeling concerned, but here is where hope comes in. Both science and medicine agree. Even after the age of 65, weight can be reduced, and doing so brings very positive benefits. Simply losing 5 to 10% of body weight can improve blood pressure, bring blood sugar under control, reduce knee pain, improve sleep quality, restore energy levels. Now the question is, how? Part 4. Safe Lifestyle Steps, a special guide for elderly individuals. Here we share steps developed in light of recommendations from doctors and nutrition experts, steps that are completely safe even after the age of 65. 1. Mindful eating, not starvation. First, let's clear up the most common misconception. Losing weight does not require starving yourself. After 65, the body urgently needs good nutrition. Simply cutting calories is not enough. Eating the right foods is essential. What to eat? Protein is extremely important. At this age, muscle mass decreases rapidly. Lentils, chickpeas, fish, eggs, yogurt, these are all excellent sources of protein. Vegetables and fruits. Eat colorful vegetables and seasonal fruits. They are rich in vitamins, minerals, and fiber. Whole grains. Lentils with husks, brown rice, whole wheat bread. These digest slowly and keep you feeling full for longer. Healthy fats. Olive oil, ghee in small amounts, fish oil, walnuts. These are beneficial for both the heart and the brain. What to reduce? Sweets. Sugar, sweets, and desserts, sugary beverages. These instantly spike blood sugar and promote fat storage. Salt, the biggest enemy of high blood pressure. Processed and canned foods contain excessive amounts of sodium. White flour. It converts to sugar rapidly in the body. Fried foods. Samosas, fritters, fried chicken. Occasionally is fine, but not every day. How to eat. Instead of 3 large meals a day, have 4 to 5 smaller meals. This keeps the metabolism active and prevents overeating. 2. Water. Simple but powerful. Elderly individuals often drink too little water because the sense of thirst naturally diminishes with age. However, insufficient water intake allows toxins to accumulate in the body, damages the kidneys, and slows down the metabolism. Drink at least 6 to 8 glasses of water every day, or as advised by your doctor. Drinking 1 glass of water half an hour before meals reduces appetite and makes it easier to eat less. 3. Physical activity. Slowly, but consistently. Many elderly people feel anxious when they hear the word exercise, imagining they'll need to join a gym or lift heavy weights. But after 65, exercise means something entirely different. Walking. The easiest, safest, and most effective option. Just 20 to 30 minutes of daily walking. Strengthens the heart, controls blood sugar, helps with weight loss, improves mood, improves sleep quality. Start with 10 minutes, then gradually increase from there. Chair exercises. For elderly individuals with knee or back problems, seated exercises work wonderfully. Raising and lowering the legs, rotating the arms, and gentle abdominal contractions while sitting in a chair. Even these simple movements keep the body active and burn calories. Water aerobics. If there is a swimming pool nearby, this is one of the best exercises for older adults. Water reduces stress on the joints, lowers the risk of injury, and engages every muscle group in the body. Yoga and stretching. Light yoga and stretching exercises are excellent for improving flexibility and balance, especially for preventing falls. Remember, always consult your doctor before starting any new exercise routine. 4. Sleep, the foundation of good health. Very few people know that sleep and obesity are directly connected. When sleep is insufficient, the body increases levels of hunger-stimulating hormones and reduces the hormones that signal fullness. The result? A constant urge to eat something throughout the day. After 65, getting a good 7 to 8 hours of sleep every night is absolutely essential. To improve sleep quality, set a consistent time to sleep and wake up. Turn off mobile phones and television before bed. Keep the bedroom dark and cool. Avoid eating anything heavy within 2 hours of going to bed. 5. Mental peace, the hidden solution to obesity. Stress is one of the biggest yet most overlooked causes of obesity. When we are stressed, the body releases a hormone called cortisol, which compels the body to store fat around the abdomen. In elderly individuals, loneliness, social isolation, and health worries all elevate cortisol levels. What to do? Spend time with family and friends. Engage in prayer and remembrance of God. These are among the greatest sources of mental peace. Take up a hobby, gardening, reading, teaching something to the grandchildren. Practice deep breathing exercises. They quickly reduce stress levels. 6. Regular medical checkups. Avoiding the doctor after 65 is one of the most serious mistakes a person can make. Get a checkup every 3 to 6 months. Check blood pressure. Get blood sugar tested. Check cholesterol levels. Record weight and BMI. Have bone density checked. If your doctor has prescribed medication, do not stop it on your own. And do not start any new medication without medical guidance. Some people begin very strict diets on their own in an attempt to lose weight quickly. This can be extremely dangerous for elderly individuals. Work with a registered nutritionist to create a proper dietary plan. 7. The role of family. Last, and perhaps most important, improving the lifestyle of elderly family members is not their responsibility alone. The family's role is absolutely crucial. If you have elderly relatives at home, pay attention to their diet. Ensure they have access to home-cooked, nutritious meals. Join them in exercise. Walking alone feels difficult. Walking together makes it enjoyable. Listen to them. Loneliness damages both mental and physical health. Take them to the doctor. Many elderly people simply won't go on their own. Praise their efforts. Even small achievements deserve recognition. It gives them the courage and motivation to keep going. Part 5. An important note. Why weight loss is different for elderly people. Friends, there is one very important point that is often overlooked. After 65, the approach to losing weight is fundamentally different from that of younger individuals. Sarcopenic obesity. This is a condition in which body weight is high, but muscle mass has become weak. If only calories are reduced without maintaining adequate protein intake and exercise, weight may decrease, but muscles and bones will weaken even further. For this reason, it is essential for elderly individuals to not lose weight too rapidly, no more than half a kilogram per week. Never reduce protein intake. Always incorporate some form of exercise, even light activity counts. Work under the guidance of a doctor or registered nutritionist. Part 6. Special considerations in the Pakistani context. There are some unique challenges in Pakistan when it comes to the diet and lifestyle of elderly individuals. Heavy use of ghee and oil. Traditional Pakistani cooking uses a great deal of ghee and oil. Rather than eliminating it entirely, reduce the quantity and give preference to olive oil or mustard oil. Sweets and tea. In Pakistan, tea is typically consumed with a lot of sugar. Elderly people who drink 5 to 7 cups of tea a day are consuming an enormous amount of sugar. Gradually reduce the sugar, or use a small amount of honey instead. Physical inactivity. Many Pakistani elderly people spend the entire day sitting at home, participating in household tasks, standing by a wall for support exercises, or simply walking a few laps on the rooftop. All of these make a real difference. Weather. In summer, outdoor exercise becomes difficult. Exercise lightly indoors or go out in the early morning or evening hours. Closing message. Friends, the summary of today's discussion is this. Obesity after 65 is a serious problem, but it is absolutely manageable. You don't need a miracle drug, an extreme diet, or hours of sweating in the gym. Just a few simple steps: eating right, drinking a little more water, a short daily walk, a good night's sleep, mental peace, and regular medical checkups. These alone can give you, or your elderly loved ones, a better, healthier, and more joyful life. If you have elderly relatives at home, speak to them today. Take one small step today. And if this video helped you in any way, please like it and share it with your friends and family, because this information can truly change someone's life. Subscribe so that more helpful health videos like this continue to reach you. Take care and God bless.